One question that a lot of patients ask, and a lot also avoid asking altogether, is what to eat before and after a surgery. And the simple answer is very basic. You have to try to increase the amount of fluids, of clear fluids that you take. Try to have a proper amount of protein in your diet, and then reduce the sodium on processed foods that you're taking. The more extended version of this answer is you have to avoid anything that will help your body upkeep more water than it should and swell up. So you basically want to reduce the amount of simple carbohydrates that you take, such as rice, pasta, bread. That's not eliminating them altogether, just reducing their amount and replace them with fresh vegetables. And try also to reduce the amount of salt you take. Try to reduce the amount of processed foods you take, and take just a bit more protein than you would normally do, because your body will need building blocks to repair itself. So we're going to talk about something that a lot of people are talking about currently. That's in everybody's conversation. That we have all know someone who has used it, or is thinking about using it, or to a point that we've never seen with other medication and with other treatments available. And those are the GLP drugs. So that you understand what we're talking about, is basically when you're normally eating anything, it passes through your GI tract. And as it does pass through your GI tract, your body is going to do things to the meal you ate so that you're able to extract the nutrients you need from it. Okay? But the meal you ate will do something to your body as it passes through, and your body will respond to it. In fact, one of the reasons processed foods are not good for you is that they are not like the meals we evolved to eat. They are like halfway through our GI tract when we ate them, because they're already broken down, and your body will react to them in a way that's not appropriate to what it should. So it's going to think that you took more sugar than you did. So you're going to spike more insulin than you need for the amount of sugar you ate. Basically, those responses that your body is having to the food you ate will inform it of what it has to do. One of the things that it has to do is, at some point, you do have to stop eating. Like, you're full, you had enough for your GI tract to work and for you to have energy and building blocks. So the markers that your body creates to inform itself that you're done eating have been a topic of interest for scientific research. Because ideally, if you can develop something that can trigger that in your body, you can avoid hunger altogether. So you can control the amount of food you eat, controlling the necessity that you feel to eat, your drive to it. So one of the very promising medications that we found in that are the GLPs. So they're basically similar to a protein that your body creates, but when your body creates it, it lasts very little. It doesn't reach an hour and a half. But the medication that we have available will either reach a day, a week, or some that are in research even longer. And this medication will trigger the response in you that you're full. So you're not hungry, and you're not going to want to eat between meals, and you're going to have lower amount of food every meal you take. So the potential for weight loss with this medication is enormous, because it can help people change their habits into something that's more suited. But the potential for harm is also enormous, because if you take them and simply don't eat, that's not reasonable. You're just developing a different kind of eating disorder. So you're going just swifting the pendulum from one side to another. So this should never be taken without proper medical supervision, and it should never be taken without proper responsibility by the person taking it. So the current medications that we have, most of them are injected subcutaneously, and they come basically in a pen like this. This is Mounjaro, just an example of one of the available drugs in the market. So basically what you get is this, that's without the tip. So it's you can just open it. And some of the drugs you can gauge the dose you're giving, so you can adjust it. And others, like Mounjaro, just have 1 point of adjustment to a single dose. Once you're ready to apply it, you have to get the needle that comes separately, just adapt it to the tip, and then use it following the instructions. For medications such as Mounjaro, you get one injection once a week, and that will help control your weight loss. Basically, the original GLP medication that went out was directed just to diabetic patients. Then, second generation came out that's directed just to weight management. All of them always under medical supervision, never on your own. Never take non-standard forms of the medication because you don't know what you're getting, you don't know what amount of it you're getting, and you don't know what contaminants can be there. So the potential for harm is enormous. But the fact that the doctor that's going to treat you if you have a complication doesn't know it either makes it a lot more dangerous than if you just did a wrong dose of a proper medication. So, the side effects of GLP medications. One thing that I always try to stress out to my patients is that no matter what you're taking, it has a long list of possible complications. Because when you see the perspective of a drug, it's the intent of it is not to scare you, it's just to compile everything that can happen so that if it does happen, the doctors will know what to do, the patient will know what to be aware of, what to be on the lookout for. But that doesn't mean that medication is not safe. It doesn't mean either that medication should be taken lightly. It's it's just like driving your car. Driving your car does have risks, but if you do it properly, you minimize those risks, but you're never away from them completely. So I would probably want you to know more what's common rather than what's severe but extremely rare, because you can get that with almost any medication. You can even get it with natural things that you can get over the counter. So the most common things that you can get are very linked to the way the drug works. So what it does, it basically reduces the speed and the mobility of your gastric movement. So your stomach takes longer to empty down your GI tract. That means that whenever you eat, food's going to stay there for longer. That means that the risk of there being gastric reflux, that's the content of your stomach going upwards through your GI tract, through your esophagus, where it can burn and cause uh, pain or discomfort for you. If you already suffered before, it's likely that you might suffer a worse version of it if you're taking GLP because your stomach's going to move slower. Since it's moving slower, you will feel yourself fuller when you eat, and the probability that something will cause you nausea or the sensation that your digestion is not working the way it should. That's what doctors will usually prefer to call dyspepsia. That will be heightened. So you can have nausea, you can have heartburn, and you can have that sensation of things not going all the way they should. Now, since everything in your GI tract will work slower because your stomach is working slower, the chances that it takes you longer to release uh, those things, that the risk of constipation will be significantly higher if you take a GLP. So if you already suffer from constipation, it's very much advisable that whatever you took before, you ask your doctor if it is safe to continue taking, and do ask it regardless of it being a natural source or a formal drug, because some will be advised, some others not, or even due to your doctor preference and individual experience with patients, she might recommend something different.